Nigeria is one country where drugs are sold easily in the open markets, even without prescriptions. In the same vein, manufacturers of various medications sell to ready buyers, irrespective of their status.
Well, I know the government will look into that, but while we are still working on this, we want to make sure that it's sanitized, what is being sold from here.
This, according to a pharmacist, Ugele, accounts for the several cases of fake and expired drugs sold in pharmacies.
I will always advise people to use registered pharmaceutical shops, outlets, because they have sworn oath that they are to sell the authentic medication.
A consultant pediatrician, Dr. Ugele, says these fake or expired drugs are capable of damaging more vital organs in human beings.
In our population now, we have so many people coming out with kidney failure. Those fake drugs and expired drugs may be one of the reasons why people are having this increase in kidney failure.
Besides the health issues associated with the intake of these drugs, there is the economic draining of consumers who unknowingly purchase them.
And it at the end also make the person, instead of going home maybe within few days, will stay longer in the hospital, assuming the patient was admitted. And also you end up spending more money, okay? So maybe instead of spending just 5,000 to treat that illness, you may spend up to 20,000.
Recently in Abia State, the National Agency for Food and Drug Administration and Control besieged a warehouse where every single medication inside is allegedly expired.
This quantity we cannot quantify yet because everywhere here is filled, everywhere. We also saw a machine that is used to do expired products. So it shows us that this is what is taking place in this place. An arrest has been made. The police have a few people, but the main person is on the run.
At the popular Omogu Bridgehead Market on Nisha, Anambra State, the regulatory agency seized yet another consignment of 40-foot-10 trucks of alleged fake and expired drugs.
So that is why this is never taken lightly in any civilized nation.
To the public, it is disheartening to know that they may have at one time or the other purchased their own problems with their money inadvertently.
I feel so bad because any fake drug produced at any point in time has a life it will affect.
They are therefore demanding for commensurate punishments against the dealers.
Because a lot of people.
NAFDAC, they should sit up to their responsibilities. If it means life jail on the person that they find selling a fake drug.
They have to give stricter laws of what should be done to such individuals. That way to deter others.
Why does it seem as if an infinitesimal population is bringing the people to their knees while the government watches helplessly? Ugele believes that restricting sale of drugs to only registered personnel will go a long way in checkmating the activities of the perpetrators.
The NAFDAC, Pharmaceutical Council of Nigeria, and all the agencies that are related to drug procurement and drug delivery. They should have registered pharmacists or registered pharmaceutical company that will have their pharmaceutical rep whose sole job is to distribute to all the pharmacies, all the outlets that need that medication.
As much as the regulatory agency raids shops, markets and warehouses to seize unregistered, fake and expired drugs, there are still lots of these drugs dumped in several pharmacies across the zone being sold to the unsuspecting public daily. It appears rather too easy to wriggle out of the custody of the regulatory body, hence the little information on the cases after raids and fewer convictions secured by the agency over the years. In Omahia for News Central, Chinwe Ugele.